So I'm here with Kimmy Wiley. Kimmy, can you tell us a little bit about yourself for those of who are listening that don't know you?
Yeah, so I'm a physical therapist. I graduated like 3 years ago, and since then I've done some travel PT. I started a little private practice working mostly with like climbers and outdoor athletes. And most recently I've been traveling with the US Halfpipe Team this winter. So yeah, lots of fun things, and yeah, excited to be here with you tonight.
Yeah, and I brought you on because one, I'm psyched to connect. It's been a while since we've, connected. You're in the
Yeah.
special interest group, back in the day. But you wrote a great article on TFCC, wrist injuries in rock climbers. And you don't know how many emails I get from climbers. First of all, that love the article. Like people really enjoy this
Wow.
article. And I think because it lays out how to assess very easily and it gives foundational exercises. But also, this is a fairly common injury with climbers. And
Yeah.
let's dive into it. And people are listening and people are also watching. So I know that you have the article prepared. And for those that are watching, you can pull up on the screen and show. And then those listening can describe. But what the heck is the TFCC? Maybe we'll start with that.
Yeah, so maybe I should pull this up right away so then we can have a nice little visual for the people who are watching. But basically, the TFCC, the big name for it is the triangular fibrocartilage complex, which
Can you say
basically
that three times fast?
I absolutely cannot.
That would be like a good warm up for, some type of vocal. That'd be our warm up for the podcast. Triangular
Yeah, it just
fibro.
keeps
Do it. Say it as fast as you can, just for fun. Go for it.
triangular fibrocartilage complex. Yep.
That's better than I could do.
That's
All right.
tough.
What is it? What is it?
So basically, it's a bunch of connective tissue, right? So it's some cartilage, it's a bunch of ligaments that connect not only the forearm bones together at the base of the wrist, but also kind of the forearm bones to the carpal bones, which are kind of those little bones at the base of your hand. So basically, what that's doing is it's stabilizing our wrist and helping kind of with any sort of impact, with kind of compression load, any sort of thing. It's just meant to stabilize and help strengthen that area.
So if a climber injured their TFCC or they're suspecting that it's injured, what are they going to feel? Like, where's their discomfort? Are there any signs that they should be aware of?
Yeah. So I guess typically what I would say most of the time, since the triangular fibrocartilage complex is located at the base of our pinky, kind of on that pinky side of the wrist, that's where they're going to have the pain, right? Specifically, if you're to kind of poke into that side, you might have some pinpoint discomfort right there. But you're also going to have pain with certain motions, especially motions that are going to be like ulnar deviation, meaning you're turning your wrist towards your pinky side and adding load to that. That's
It's
going to
kind of
feel
like you're throwing
uncomfortable.
a dart that like
Yeah,
direction,
yeah,
right? Yeah.
exactly. So that's going to be a little bit painful usually, and then also extending your wrist and putting pressure through that. So thinking about moves on the climbing wall like mantling, trying to put weight through it while your wrist is extended, usually isn't going to feel the best.
Yeah, and
So
I get
yeah,
a lot of people coming in too, and they're like, climbing's actually okay, except for like weird slopers and maybe
yeah,
occasional mantle. But I can't do yoga or I can't do like my core exercises because those are like weight bearing on the wrist. And I
totally.
can't
Yeah.
train as hard is like a fairly common thing that I see.
Yeah, yeah. I think that's kind of my thing. I've dealt with that sort of pain before. I don't know if it was like a true TFCC or whatever else, but pain under like weight bearing with my wrist extended, like trying to do a push up used to hurt my wrist so bad, right?
Oh, how did you fix it? People want to know, how did you
Ah,
fix it?
yeah, right? You
Yeah.
get strong,
You get
right?
strong, all right.
So that's like the big thing is like when we have these sorts of injuries, how can we dial back that range of motion? How can we dial back those activities that are aggravating while strengthening in ways that's not going to hurt it more? So for myself,
Yes.
doing things in like a neutral range of motion feels great, right? So
So
push-ups
it's
on my
not too
fist.
far to that ulnar
Yeah,
side or okay, got it.
yeah, exactly. So as long as my wrist wasn't fully extended under weight, I could do push-ups on my fist. I could do like wrist exercises with a dumbbell. I can do what we call overcoming isometrics, where you're just like pulling on a bar and not moving it, but just trying to push it in different directions as hard as you can. And that stuff is all great for strengthening in a range of motion that's not going to be aggravating. Right.
Got it. Well, we'll dive deeper into how you lay this out step by step. But all right, someone comes in, someone listening, they're like, all right, I have this discomfort on the inside of my wrist while climbing, training, whatever. What can they do, or what would a medical provider do? Are there certain tests? I know you describe these in the articles to almost rule in this injury over other injuries, to say, okay, this is likely, a TFCC injury. What can a climber do or have someone do for them to rule in?
So the first thing's just going to be that location of the pain, right? So making sure it's kind of at the base of the wrist on that pinky side is usually a pretty good indicator that it could be the TFCC. If it's tender to the touch, as you kind of dig into that side, then we might know it might be TFCC. As well as like if we're loading, like you were saying, like we're throwing a dart, right? So we're doing that ulnar deviation is what we call that. And then we overpress. So we push down on that. If that's causing pain, we might think TFCC.
You have a lot of mobility. I'm watching you do that. Like, yeah. You have a lot of ulnar deviation as I'm watching you do that motion.
Totally. And I think that's probably where my wrist discomfort has come from in the past, is just like slightly hypermobile. Right.
Yeah, it goes a lot in that position. But okay, so someone can overpress their wrist into ulnar deviation. What else? What are the other tests?
Having your wrist extended and trying to like lift up something. So say you put your hands under a table and try to press up. If you're having pain in that same region with that, we might also think maybe it's that sort of deal. Basically moving our wrist back and forth, or I guess side to side, from towards our thumb side, towards our pinky side. If those sorts of motions hurt, if extension under pressure hurts, those are kind of the biggest ones, I would say.
Yeah, and there's a fun thing I do. I don't know if it's fun. It's fun for me, maybe not for, for people being tested. A scientific method where I take like an analog scale. I'm not sure if you've done this. And I have someone go in like hands and knees position. They press into it. They see how much pressure on the scale, 20 pounds it takes for pain to come on, and then you stabilize that area, with a widget or tape or something like that, and you see if they can press more. And that's also an indicator. If they can press more when the TFCC is like externally stabilized, well, that could potentially be a diagnostic test.
Definitely. I think that's a great way to look at it. Anytime we can add a little bit of that stability to it, where that cartilage complex might be lacking and the pain kind of goes down, that's a pretty good indicator of what's going on.
All right, so we have the foundation laid out now. We know the signs, the symptoms, we know the test to test for it. And what happens if someone's positive for these tests? Or what if someone wants to prevent this from occurring and they really want to work on wrist mobility, stability? In the article, you laid out really nicely this kind of step-by-step process. And you and I were talking before the podcast as well. And you're like, what'd you say when we were chatting about the article?
I was just telling Jared how I had just read this for the first time since it was published when I was back in grad school, and how a lot of things have changed since then. And there are definitely some things that I would have written differently. So I'm excited to dive into that today.
Break apart. Pretend that someone else wrote the article. By the way, the article is great. I actually really like it. But pretend that someone else wrote the article, and then you can like start to, tease apart some comments.
Definitely. So I guess I kind of go through the step-by-step process of like, we want to first build back our mobility, so working on range of motion. Then we want to build back our strength, right? Then we want to start getting into more of the movement specific stuff that we can do on the climbing wall, right? I think my biggest issue with what I wrote was the time frames, because that's going to be so different depending on the extent of the injury, and that it's not necessarily going to be like one, like step by step, right? You can start strengthening in a neutral range of motion pretty darn quickly as long as it's not aggravating, right? you don't necessarily have to have that full range of motion before you can start strengthening. So
Yeah,
that's
and this
kind of
is
one of
an
my big
interest.
things.
Yeah, and I think this is an interesting injury where if you wait too long to strengthen and you're really just working on flexibility, can you imagine for you, like I watched you move your wrist in ulnar deviation and you have a ton of motion. And if you were
Yeah,
like really working on more motion in other directions, you may be missing the target. So yeah, I think that's really prudent advice. Is a lot of the components of the article are awesome. And I think they're still valuable to follow in that linear progression,
totally.
but it's not always linear, right? And you may
Yeah.
want to jump to strengthening safely earlier in the phases. So, all right, so break it down. What do we do? Give us your wisdom.
Yeah. So if you are having kind of those symptoms and all those tests were positive that we're talking through, our first thing is going to be deloading somehow, right? So if we injured our wrist somehow and climbing's aggravating, maybe we need to change the way that we're climbing, or maybe we need to take some relative rest, right? And so what I mean by relative rest, I don't mean that you have to like not climb at all, right? In some
Yeah.
cases, maybe that's a good idea, but maybe it's just changing the way that we're climbing, right? Maybe we're avoiding those positions that are really aggravating, right? So maybe skipping out on the mantle, skipping out on like Gastones where our wrist is really cranked back into extension or really cranked into that ulnar deviation that we were talking about. So avoiding the motions that are aggravating and then dialing back maybe the total amount of climbing that we're doing. So just creating like a lower dosage of climbing in general, a lower volume. So we want to deload somehow, and that might be, like I said, resting completely or dialing back how much we're doing.
And deload training in addition to climbing, right? Like,
yeah,
meaning,
yeah.
I mean, don't do as many planks or do planks with neutral wrist, right? That's kind of what you were doing as well, right? You still were able to do weight bearing exercises, but you changed the orientation.
Exactly. Yeah. It doesn't mean you have to stop exercising completely, right? Like if my big toe hurts, it doesn't mean I have to stop doing pull-ups,
Walking.
right?
Or
walking. Yeah. It just means like maybe we dial back the activities that are super aggravating and we learn how to modify those positions so that we can still continue to exercise and still continue to get stronger, but without making the injury a little bit angrier, right?
Yeah, I think that wrist injuries, this is just my opinion, I'm interested in your thoughts, but I think certain wrist injuries more than other body regions are ones that you can kind of climb through and train through if you're smart and creative without taking as much total time off than, let's say, like a pulley injury or something like that.
Yeah, I would 100% agree with that. Because most, like, if you have like a true TFCC injury, as long as your wrist is in a relatively like neutral position, you can probably still crimp pretty hard. You know, you can climb jugs all day as long as you're not extending, compressing that area excessively. You should be okay to keep doing a lot of what you're doing, right? But you also don't want to do too much and aggravate it further and kind of prolong that healing process. So it's important to kind of take into account, like, what am I doing on the wall and making sure that you're not, pissing things off more, I guess. And I think adding to that inflammation cycle.
Yeah, and really knowing one thing that's not talked about that much, like I trad climb much more than I, boulder or sport climb. And like hand jams are like brutal for the TFCC because you're going into that pinky side ulnar deviation, loading it, and then you're like putting all this traction force, which is actually the opposite, right? Like the test that you're talking about, you're like compressing down, but it can also be loaded unstable, like an unstable position through traction. So
totally.
Yeah, just sounds like just being smart about what you're climbing. But hopefully, these are a couple tips and nuances that people can use to be a little bit smarter. So okay, after you deload or unload, and you do that appropriately, or even while you are deloading and unloading, what else can you do?
Then we want to start kind of building back into that range of motion, right? So maybe we can get into full extension without weight bearing. at the start, but then we want to start adding
extension. You mean, just for people that don't know the anatomy, just bring your wrist backwards, right?
Yes. Yeah, exactly. Bring your wrist backwards. So lots of times, like for most climbers, it won't hurt for you to just do that range of motion without any weight. But can we start to do that with more load, right? Can we do it with a dumbbell? Can we do it into a weight-bearing position like a push-up or a plank or something like that? And how can we gradually rock onto that so we're, using more weight through that wrist while not, so we're building up the load tolerance to the wrist. Yeah, I don't know exactly.
I think it's hard because, it's progressively loading the wrist without flaring it up. And that's probably, I think, the hardest part of this rehab. It's almost like, I forget the cartoon, is it Goldilocks, where like there's bears and porridge and they're like a little too much, a little too little, and then just right? Is that the right nursery rhyme?
Yeah, definitely.
Okay. Yeah, so it's like you have to have the right amount of load without overloading. And this is where I think a good pitch to see a good medical provider, a physical therapist, to guide you through that process is probably a good thing.
Yeah, I think 100%, because I don't know, as like an athlete myself, my go-to is just to like try to jump back in, right? If it feels okay enough while I'm climbing, I'm going to accidentally do some crazy dynamic mantle, and then my wrist is going to hurt again for the next week. So how can we gradually load into that? Maybe by being like on all fours and rocking into it, then maybe going into a push-up, then maybe going into a one-arm push-up, and just like gradually kind of increasing that load instead of just jumping into things right away.
So here's the question then. Knowing what you know now from when you wrote this article, in this loading stage, is there anything that you would say, oh, this is like a cool different thing that's not in the article, or anything that you would potentially add to like this mobility category? Or is everything in the article about where you're at now as well?
My biggest thing is that I think the article, I don't know.
You're going to go in and like revise the article now after this podcast. You're like, can you take my name off of it, by the way?
It's really not bad. I think
it's great. I think you're being self-critical.
Great basic information. I'm just like such a big fan of isometrics now, right? So like really loading things up in a neutral position and then gradually building into that range of motion. So maybe I do an isometric in complete wrist neutral. Then maybe I do an isometric with my wrist slightly extended. And then I slowly keep working into that position under more and more load. I'm a big fan of that. I'm a big fan of like the heavy weights in a non-aggravating range, right? So that's kind of what I would add in to the article. That's my big takeaway.
Yeah, it sounds like just increasing that range, but with an isometric load allows you to have mobility and stability at the same time, which is kind of what you need for a TFCC injury. So
yeah, totally. Yeah.
All right. So what happens after mobility? Now we're entering the, whether it's linear or whether it's you're doing this all at once. What else is necessary for a TFCC injury?
Yeah, so after that mobility phase, we want to be in the strength phase, and you can do them kind of at the same time. Like I said, starting in that neutral range of motion and getting really strong in wrist neutral is going to feel better at first than going into full extension and getting strong right away. So we want to start off in neutral, and then we want to slowly work into those more aggravating positions and slowly build up the strength and the range of motion. So the wrist has 6 different motions, which is kind of a lot, right? So there's flexion, where we kind of point our hand down towards our forearm. There's extension, where we kind of bring our wrist all the way back.
If anyone is watching this versus like listening, you should see the difference between Kimmy's extension and mine.
Yeah, it's pretty
This
big.
is, by the way, my end range active.
Oh, man,
okay.
Yeah.
Oh! Kimmy has much more wrist extension. All right.
And then there's ulnar deviation, right? Like we're throwing a dart forward, right? So your pinky side is coming down towards your forearm. There's radial deviation, where your thumb side is coming towards your forearm. And then there's pronation and supination, where we're rotating our wrist, right? So basically, we want to strengthen all those things, right? So we want to strengthen in rotation. We want to strengthen in our side-to-side motions and in our back and forth motions.
So what's the best way to do this? In the article, you have a few ways, right?
Yeah. I don't know if there is a one best way, right? I think you can strengthen your finger flexors, your wrist flexors by doing things like hangboarding and climbing. You can strengthen those extensors by, doing isometrics like we're talking about, by going through a full range of motion with a dumbbell. And you can do that same thing with rotation, right? So I don't think it necessarily matters exactly what you do. I think it matters that you're starting to build into that range of motion more and you're starting to build up that load. So whether it's dumbbells, whether it's like a PVC pipe with weights on it, whether it's doing isometrics on a pull-up bar or climbing, as long as you're getting stronger and doing it in a progressive way, that's the big thing.
Yeah, the best exercise is the one that you do, right?
Exactly.
That's probably
yeah.
So whatever, if you're a band person, do bands. If you like PVC pipes, do the PVC pipes. Like do the thing that you will actually do.
100%. Yeah. If you're like one of those wrist curl guys or girls, go for it.
Yeah.
Like whatever feels best for you, and as long as it's making you stronger, and as long as it's not causing more pain and inflammation over the next 24 hours, then you're doing okay.
So how important do you feel is the finger position when you perform wrist exercises? So for example, you can grab a dumbbell and you wrap your fingers around the dumbbell and make like a tight fist, right? And you're doing these exercises. Or you can grab like a 2-inch PVC pipe and your hand is open up, almost like open hand grip climbing, and you're doing these exercises. How important, after the fact that it's like, okay, you chose your type of exercise you want to do, right? How important is the hand position, do you feel, in rehabbing these injuries? Is that more of a nuance, or is that actually meaningful?
I'd say it's more of what your climbing goals are and what you want the lever arm to be, right? So anytime your fingers are a little bit more open, right, more in that pinch position, it's going to feel a little bit harder for the wrist, right? So if you're wanting to climb more slopers or pinches or that sort of thing, that's a great thing to work on, right? If you don't necessarily want that, if you're just like, I'm going to climb some 5/8 jugs, then
good for
maybe you
yeah.
want to be able to curl your hand up more. I don't necessarily have a huge preference. I say variety is the best thing, right?
As far as variety is the spice of life.
The spice of life, yep.
All right, so I get those exercises. They're all what we consider like open connect chain. They're all, you're grabbing something and you're moving it side to side, and that makes sense that it strengthens the wrist, but that's not exactly what we do when we climb, right? Aside from maybe you're opening up your grip more, you're changing your finger position, but you're not really doing that much when we climb. The rock is immovable versus like a soup can or a dowel or a weight moves. And so how can you get more and more specific towards climbing with TFCC exercises?
Yeah, I think moving into those closed chain type motions are the next step, right? I think open chain is a great way to start because you can be really diligent about how much weight you're adding and you can kind of quantify that as you go. But moving into those more closed chain position, meaning that you're moving around your hand and moving around your wrist, that's kind of the next step. So getting into push-up positions, pull-up positions, hangboarding, right, where your wrist and your hand is fixed and you're moving around that, that's what's going to be more applicable to climbing, right? So before maybe doing like a one-arm mantle on the wall, maybe we want to get into a push-up position, right? Maybe we want to be able to load into that a little bit more before we start doing crazy stuff on the wall.
Yeah, so what would be an example? All right, I'm going to give you a scenario. Someone has a TFCC injury. They did all these tests we talked about, and loading it hurts in this like plank position on the scale. They have a little bit of pain. It's not too bad. They've done the strength, the mobility. They've taken time off, and now they want to return to doing, let's say, downward dog, sun salutation in yoga, right? They're going from a downward dog, they're dropping down into a plank, up dog, this whole kind of sequence, basically trying to weight bear.
Yeah.
How would you get them progressively? Because that sounds like that's really the challenge. And this is kind of what you did, I'm assuming, with your wrist. And well, maybe I'll simplify it. Let's just say they want to do a plank. They just want to do a plank. All right, how would you get them doing a plank, but progressively, and kind of break down what that feels like?
Yeah. So for me, I started off in that neutral position, right? So fist on the ground instead of...
Fist on the ground. That's hardcore. That's yeah. What if there's someone's like not as tough as you? Like if I were to do like a plank with my fist on the ground, that hurts my knuckles.
Yeah, that's more of like a modification than like a true, I say, fix. Okay. So if we're trying to get into that wrist extended position, I would say maybe we start off on all fours, right? Where most of our weight is on our legs and not so much on our wrist. And maybe we start to rock into that, right?
That makes sense, yeah.
Yeah. And so maybe we change our wrist into different positions. So instead of our fingers pointing forward, we point them off to the side. So we're in more of that ulnar deviated position and we're adding more weight to it that way, right? So gradually kind of rocking into it and putting more weight on that wrist in like a quadruped position. So with your knees on the ground, with your hands on the ground. Once that starts to feel good, maybe we lift off the knees and we go on the toes, right? Like we're starting to get into more of a plank
like
position,
in a bear position, right? You're like hands and knees, but your toes are keeping your body up.
Yeah, like a bear crawl. Yeah, exactly. And so we start loading into it that way. And if that feels good, then maybe we get into a plank position, right? If that feels good, maybe we do a one-arm plank or we do like shoulder taps where all of our weight is on that one hand and like our 2 feet too. But then just gradually progressing it like that, where we're putting more and more weight through that hand with kind of less, I don't know. We're just putting more less and more pain. Weight onto that hand with less pain. Yeah, exactly.
So this is probably the hardest part, I think, of the rehab. Is there like a rule? Is it like, all right, no pain? And this is, I'm just asking your opinion. Yeah. Actually, for those of you listening, there is no answer to this. We don't know. But your opinion, like you're working with a patient, what are your parameters to say, okay, this is safe? This is something that you can do safely and progress?
Yeah. I think it's natural to have pain after not being in positions that have been aggravating in the past. I think it's natural to like have that immediate pain response when you start to work back into those. So it's a matter of gradually loading into those and making sure that that pain isn't something that's affecting you over like a 24 to 48 hour time frame. I think looking at the next day is kind of the indicator of whether or not we did too much or we can kind of push it further, right? So if I'm doing that kind of bear crawl loading into that, and then the next day, like I can't lift the trunk of my car up because my wrist is hurting, it was probably too much, right? But if the next day my wrist feels the same or even better, maybe I can start to progress a little bit further.
Yeah, I think that's good advice, is really that 24, 48 hour time frame of it's going to be a little uncomfortable, obviously, with this injury to progress. I mean, that's natural. I have that very frequent with my clients, and you just have to be aware. If you have pain that extends beyond 48 hours, okay, right? Dial that back. And
yeah.
I think you're even mentioning, I mean, the fist push-ups, I think those are tough on me, but I normally use like heavy dumbbells, like a, well, I guess it's heavy for me, but the 35-pound dumbbell or 40-pound dumbbell, and just have that on the ground though, and then your knuckles clear. And so that's like how I'll typically, if I want to avoid like loading my wrist, do some push-ups. But I think there's a ton of different methods. Are there any other exercises or recommendations that you have, for this injury?
As far as like exercise recommendations, not a ton. Like it might just be all logical to me, so maybe other people might want a little bit more guidance. So I guess the big thing is, right, when we have an injury, we want to start building up the strength in an open chain first, right? So maybe we use dumbbells, maybe we do isometrics where we're holding onto a pull-up bar and just trying to push it in different directions, right? We're in more of that neutral position. Then we want to start building in that range of motion. Then we want to start adding weight. So doing things like the push-ups, the gradually loading into when we're weight bearing on those wrists. I don't know if there's like one specific like fix it all exercise. I really don't think there is, but
I don't think there is in life. Yeah.
I mean, I really love like wrist wrenches, if you know those. Yeah. Mm-hmm. Like a wrist wrench. I'm a big fan of those. I'm a big fan of like a dowel.
And describe the device for people that may not know.
Yeah, so a wrist wrench is kind of like a larger like PVC pipe or like tube type thing. It could be even like a water bottle that you hooked up webbing to. And then you can curl that webbing or rope around there so that it kind of torques at a different angle and add weight to the bottom. And so you can kind of resist yourself into wrist extension or wrist flexion and just holding it off the ground. I don't know if I explained that the best, but
yeah, I'll pull up for those of you that are watching. And by the way, we have no like affiliation or links or whatever it is.
No, not at all.
Yeah, no affiliation to any of these products. But yeah, this is like an example of on the screen of what Kimmy was mentioning. And there's a bunch of different versions of wrist wrenches. But I think it's important. First of all, what I say is I love your article. I think you're being harsh on yourself with retrospection. But I think with these injuries, a good take home is what you're trying to allude to is it's actually not that complicated. Like you don't need this crazy like band pulling this way, moving your wrist on one arm on a Bosu, like all these different things. You just need to progressively load and strengthen and be mindful. And I really think that's what you're alluding to.
Yeah.
And also, I really like that you mentioned it's not always linear because that really speeds up the process. If people can do these strength exercises, these movement exercises early on, through the stages.
Yeah, totally. And like
what final words do you have on TFCC? And this final thought or piece of wisdom, can you say it in a rhyme? Can you make it rhyme?
Can you say it in a rhyme?
Yeah, it only has to be 2 to 4 lines, but it has to rhyme. Oh, put on the spot.
Oh, yeah, I'm like a horrible poet. I don't want to be that like no pain, no gain person, but when you are loading into it, you may have some pain. So,
and that's okay. You're not insane. That's
okay. You're not insane. Yeah.
There we go. That's a wrap. Awesome. Well, Kimmy, thanks for coming on. I know you're super busy traveling with the ski team and doing all the awesome things that you're doing. It's great to see you, progressing from when you're a student to just, killing it in clinical practice, and, with your company as well. So I'll make sure to add all that stuff in the show notes. But if people want to get in touch, reach out. What's the best way that people can learn more about you?
Yeah, you can find us on Instagram at Peak Pursuit Rehab. Otherwise, peakpursuitrehab@gmail.com. That's our email. And yeah, feel free to reach out anytime, and we're happy to help if we can get around to it. I'm not always the most timely with answering DMs, but I do my best.
Awesome. All right. Well, thank you, Kimmy. Good to have you on.
Thanks, Jared.